Hello friends, let us now learn some important points about adenoma. Adenomas will represent, so these adenomas will consist of around 5 to 10% of nodular thyroid disease. So adenomas will constitute of around 5 to 10% of nodular thyroid disease, and they are more common in females than in males. So women are more commonly affected with adenomas when compared to men. And one more important thing is the thyroid function is normal in an adenoma. In only less than 10% of patients where you can see increased functioning of thyroid gland resulting in thyrotoxicosis is seen in less than 10% of patients. But in majority of patients, the thyroid function is found to be normal. So this adenomas can be either they are present either singly, that is solitary, or they can be a part of multinodular process. That means they can either be present as single, that is solitary, or has a multinodular process. So if you see, one of the important type of adenoma is benign follicular adenoma. This benign follicular adenoma is actually a true thyroid neoplasm. Why? Because in benign follicular adenoma, if this is the adenoma, it starts compressing the adjacent fibrous tissues. It starts compressing the adjacent tissues and also the thyroid tissue or even the capsule of the thyroid will get compressed by this benign follicular adenoma. If you see the types, there are various types of benign follicular adenoma. Among them, the most common types are these three. One is fetal adenoma. Second, we have Hurst's cell adenoma. The third, we have embryonal adenoma. So these three are the most common types of follicular adenomas. Right. This follicular adenoma is actually a benign lesion. There is a counterpart of this follicular adenoma which is called as follicular carcinoma. So, what is the difference between follicular adenoma and follicular carcinoma? How are you going to diagnose between follicular adenoma and follicular carcinoma? So, if you see the cytology features of both follicular adenoma and follicular carcinoma are same. So FNAC looks same for both follicular adenoma and follicular carcinoma. So you cannot differentiate using an FNAC both these disorders. Then, if you see the main distinguishing features between the follicular adenoma and follicular carcinoma is vascular and capsular invasion is absent in follicular adenoma, whereas this is present in follicular carcinoma. And this vascular and capsular invasion is mainly found out by a biopsy rather than FNAC. And one more important thing is it is better to remove the tumor surgically and then do a biopsy or histopathology is recommended. Then, what are the sonographic features of these adenomas? Okay, these adenomas are again solid in shape, right? They are solid lesions, and if you see, they are mostly hypoechoic, right? This is hypoechoic. They can be isoechoic also, or they can be hyperechoic also, especially this is one of the hyperechoic lesion. You see, this is also a little hyperechoic lesion. They are well defined, solid, hyperechoic or hypoechoic or isoechoic lesions, and they have a thick hypoechoic halo. You can see the halo surrounding here, right? They also have a thick hypoechoic halo is seen. And why is this hypoechoic halo present? This is because the adenomas have a fibrous capsule and they also have peripheral blood vessels, which gives the appearance of hypoechoic halo surrounding the nodule. So if you do a Doppler imaging, okay, a Doppler imaging, you can see that the vessels mostly gives a peripheral vascularity. So here you can see the peripheral vascularity which is seen with these adenomas. And rarely you can also see that there is increased vascularity can also be seen, okay, with the with these adenomas. And one more important thing is spoke wheel appearance. Okay, this is also a type of Doppler characteristic feature, which is spoke and wheel appearance, where there is peripheral vascularity with vascularity seen like spokes of a wheel, like this. Okay, so this is spoke wheel vascularity, and this spoke wheel vascularity is also a sign of benignity according to this paper. So these are the important features of adenomas of thyroid. Thank you.